I am Dr. Kristen John. I am a registered physical therapist that is here working in collaboration with Ask the Doctor series. And I'm going to talk today about a topic that nobody really wants to talk about, but we have to because so many people are affected by it, both males and females. And it's about those who are unable to hold it in. Urinary incontinence, also known, it's like, urinated or peeing your skin when you don't want to. I know, but we got to talk about it. So let's begin. So I hope at the end of today's presentation, we're able to just define what urinary incontinence is and just some simple self-management tips for urinary incontinence. Now, what is urinary incontinence? Because technically, you can also have another type, right? Where sometimes you stool uncontrollably. But today we're just focusing on when there's an involuntary loss of urine, also known as urinary incontinence. And this is a very common disorder, but nobody really talks about it. So lots of us feel like we're alone. And there are over 6 different types of urinary incontinence. So sometimes, you feel like you have to pee right now, because if you don't pee right now, you're going to soil yourself. And then there's also sometimes when you feel like you want to cough or sneeze, and then there's some spillage happening. All of this is known as urinary incontinence, okay? Now, what are some of the risk factors? Some of the risk factors include age. Now, remember, there's a muscle, the pelvic floor muscles. And as we get older, if we're not building those muscles as we build our biceps and we build our back muscles and our leg muscles to be stronger, then it's going to get weaker. The more weight you have, or even pregnant women, the more weight you have, it puts more pressure on those same pelvic floor muscles, and as a result, increased involuntary loss is expected or can happen. Women who have a higher number of children tend to be more likely to also experience incontinence. Persons who do vaginal delivery are more likely to experience incontinence, though persons who do C-section can also have urinary incontinence. And sometimes it just runs in your family, unfortunately. Now, what I want you to understand today is that pelvic floor muscles must contract to provide support and avoid incontinence. So if your muscles are not strong enough to tighten or contract, then there's going to be that spillage or that involuntary loss. And in order for you to be able to urinate or defecate well, that means like pass stool, then you must be able to relax those muscles. So sometimes there are a group of persons, not only is the muscle unable to contract, sometimes the muscle is so contracted that it doesn't relax to allow for free passage. All right. However, the best persons to make that diagnosis is not you. It's your pelvic health professional. Okay. So there are a group of persons called pelvic health therapists, and that is what they focus on. They would go in, they would assess, they would ask questions, they would look at surrounding structures, and they would come up with a customized program to help avoid this embarrassing condition from persisting. But there's still some things we can do while you await your appointment. Now, there's something called avoiding diarrhea. And before you reach your healthcare professional, trust me, you could tell them I told you. They would love that you got your hands on this. This can be found online. You could type in, daily bladder diary, but also at the end of the presentation, you are going to see where I was able to source this, okay? Now, I want you to, if you believe that you are having problems holding it in, or it's just leaking out, right? I want you to understand that you should monitor how much juice or water or liquids you drink, and just to see how that presents. Is it that you have to rush to go to the bathroom? When does it happen? When does it not happen? And you monitor that information over a week or 2 week period, and then you see your healthcare professional and they'll be better able to guide you. So this was actually sourced from the National Institute for Diabetes and Digestive and Kidney diseases. Actually a free resource, okay, because we want to allow you to better able explain yourself, because it's already such a tough topic to talk about. But the information gathered from this bladder diary would be able to be a guide for decision making for bladder retraining, including if you need avoiding schedule, meaning your healthcare professional will tell you, we're going to start to work on making a deliberate effort to go to the bathroom every 2 hours so that we don't wait till we feel to urinate to do so. Okay. Now, bladder training attempts to break this cycle by teaching patients how to avoid on schedule rather than having that urge just take over you. But your healthcare professional will walk you through this best, okay? There are some other things you can do, and I know most of us may identify those Kegel balls. So they're inserted into, for the females, the vaginal area, and they're going to contract or tighten your muscles. Now, a lot of us grew up hearing saying, especially to pregnant women, did you do your Kegels? Did you do your Kegels? It is not for you to do without being properly assessed. Because if your muscles are actually pretty healthy, meaning like, good strength in those pelvic muscles and good tone, you may actually be doing yourself a disservice. Kegels should be done on pelvic muscles that are weak. Okay. Now, there's no way for you to really do that unless you go to the specialist. All right. So I don't want us to just say, I should do some Kegels today. No, we're not going to be so laissez-faire about it. I want you to ensure that you see the right professionals, let them do the assessment if you believe you're having trouble, and they will best guide you as to what exercises you can do. I want you to also note that the body is very connected. So not because the condition has to do with your pelvic floor region or where you went to defecate or pass stool or urinate or pass pee, not because it's in that area means that's all your exercises will be about. Breathing exercises are also done. Postural exercises are also done because they all play a key and important role in your rehab. Okay. Now, Pilates, have you ever tried Pilates? It's awesome. It looks easy, but boy, Pilates gets all your lumbar, your tummy. Lumbar means like your back muscles, your tummy muscles or your abdominal muscles, and your pelvic health muscles, giving it a really great workout, allowing to support you better. So a Pilates class may be a wonderful addition for those persons who are thinking about ways they could help manage it. Remember, all this is being said loosely, right? And hoping that you're actually seeing your specialist before pursuing. Now, as I've been talking about, your pelvic health therapist is the best suited person, but I just want you to know where to look. There are some different strategies they could use, like surface EMG, where basically they would use a machine to just help you retrain the muscles, because many persons are unaware as to how to activate or contract and relax your pelvic health muscles. So they are there to assess and guide and come up with a nice, customized, tailored program for you. So I want us to understand that we don't have to go through this embarrassing condition in silence or by ourselves, or just changing pad after pad after pad or diaper after diaper if you're a male. I want you to understand that there's help. The research shows us that less than 25% of persons actually go get help, and there's help sitting there. Google pelvic health therapist near me. Alexa, find pelvic health therapist near me. Siri, find pelvic health therapist near me. And let's see if, what we need to do, what changes we need to make to be able to improve our quality of life and not have to, go around feeling lesser than we have to, because there is help there. So feel free to check out these free websites as I was telling you about for the voiding diary. For any questions or clarifications, ensure that you see your physician. That's key for any incontinence concerns. So these are the websites: icsoffice.org or nafc.org. Thank you for your time. I hope this was beneficial to you.